I'm Micah,
And I'm Vanessa.
and today we're going to be talking about nutrition during pregnancy.
The placenta is a spongy structure that develops in the uterus at the beginning of pregnancy. There is also two other structures that form along with the placenta, known as the amniotic sac and umbilical cord. As you can see in the photo, the amniotic sac is a fluid-filled balloon-like structure that houses the developing fetus, and the umbilical cord is a rope-like structure that goes from the fetus's belly button all the way into the placenta to take all the nutrients from the mother. Fetal growth and development. For the first 1 to 2 weeks after fertilization, the ovum is known, or the cell is known as a zygote, where it will implant itself in the inner uterine wall. And then from there, weeks 3 to 8, it'll be known as an embryo, where it will double every 24 hours and it'll have a complete central nervous system, a heartbeat, digestive system, well defined fingers and toes, and the beginning of facial features. After those 8 weeks, the baby will be known as a fetus and will grow for the next 7 months. Each organ grows to maturity according to its set period, with bigger intensity at sometimes more than others. And then critical periods in pregnancy are times of intense development and rapid cell division. This is a sense that those cellular activities only occur at those specific times. And it is important to note during these critical periods, if there is an adverse influence, it'll impair the fetal development and full recovery will never happen. And if an adverse influence happens after those critical periods, the fetus will still have a chance to recover completely. Neural tube defects. There are about 3,000 in the United States pregnancies that are affected by neural tube defects. These are malformations of the brain, spinal cord, or both during the embryonic development. Anencephaly is when the upper end of the neural tube fails to close, resulting in miscarriage, or if born, it dies shortly after. Spina bifida is seen where there is an incomplete closure of the spinal cord and its bony encasement could result in meningitis, paralysis, and death. To prevent these conditions, women take the B vitamin folate, and these are consumed 1 month prior through the first trimester of pregnancy to help reduce those, to help prevent neural tube defects. Fetal programming and chronic diseases. When pregnant, the mother's nutrition can change gene expressions in the fetus, meaning the development of obesity could be avoided for the child depending on the nutrients the child was given during its development. And for chronic diseases, research suggests that dietary influences at critical periods program the infant's bodily structures by permanently changing an organ structure. Undernutrition can limit liver growth and program lipid metabolism in ways that the infant will develop cardiovascular disease as an adult, while overnutrition can lead to obesity type 2 diabetes, heart disease, and more. Maternal diets rich in nutrients like folate can have epigenetic effects that can protect the developing fetus against obesity in child and some cancers in adulthood. Weight for women getting pregnant is important before pregnancy. They should be at a healthy weight, meaning their BMI should not be overweight, and a healthy weight for their height. And then with that case, they would need to gain 25 to 35 pounds, which is the recommended, because after pregnancy, women struggle thinking about getting the weight back off. Although if you stick with the ideal recommended weight gain, you'll be able to have it off after having your baby with a diet and regular exercise. Nutrition during pregnancy is important because a woman undergoes various changes in her body during pregnancy. She can best prepare for these changes with a nutritious diet, regular physical activity, plenty of rest, and care and a caring companion. Some of these changes include the uterus and its supporting muscles increasing in size and strength, her blood volume increasing by half to carry the additional nutrients and other materials. As you can see on this chart, energy and nutrient needs during pregnancy, as well as lactation, are a lot higher than a woman that is not pregnant. And in some of these cases, in most of the cases, when the woman is lactating, the nutrients are a lot higher than when pregnant. Other nutrients, some intervals between pregnancies compromise the growth of the fetus and health of the mother. The recommended interval between pregnancies is 18 to 23 to give the woman time to recuperate all the nutrients that were lost when giving birth. Physicians routinely recommend daily multivitamin mineral supplements for pregnant women, as well as prenatal supplements that have greater amounts of folate, iron, calcium than regular multivitamin mineral supplements. Common nutrition related concerns of pregnancy are nausea and vomiting, constipation and hemorrhoids, heartburn, food cravings and aversions. Most of these are due to the change in hormones of pregnant women, and most are very common and regular. Although if they carry on for an excessive period of time, the woman should go see a physician.
High-risk pregnancies. A pregnancy that may jeopardize the life and the health of the mother and infant is what would be considered a high-risk pregnancy. Aspects that can characterize a high-risk pregnancy may include premature delivery, difficult birth, restricted growth, birth defects, and early infant death. Some risk factors may include insufficient or excessive pregnancy weight gain, multiple previous pregnancies, short or long intervals between pregnancies, previous history of problems, twins or triplets, and low or high birth weight infants. Infant birth weight. High-risk pregnancies are often likely to produce infants born at low weight, and this is usually classified as an infant who is 6.6 pounds or less. Infants born preterm before they're finished fully developing in the womb are commonly underweight. Another theme associated with low birth weight infants is being more prone to complications during delivery, increased risk of birth defects, becoming ill, and dying earlier in life. General malnutrition. Malnutrition can affect fertility, pregnancy, and fetal development all in negative ways. Malnutrition/inadequate food and food deprivation can interfere with the ability to conceive and one's fertility levels. If a woman is malnourished during pregnancy, her ability to store nutrients is impaired and she is less likely to birth a healthy baby. Consequences of malnourishment on the baby are fetal growth restrictions, birth defects, stillbirth, preterm birth, and low infant birth weight. And this is largely just because the infant is not getting all the nutrients it needs when it is developing within the mom. Food assistance programs. Oftentimes, women need help getting groceries and adequate nutrition when pregnant or postpartum. Because of this, there are numerous food assistance programs like WIC. WIC is a high-quality, cost-effective healthcare nutrition service program for women, infants, and children in the United States, providing nutrition education and nutritious foods to infants, children to age 5, and pregnant and breastfeeding women who qualify financially and have high risks of medical nutritional problems. Pre-existing and gestational diabetes in women. Before getting pregnant, if a woman has diabetes, she needs to ensure that her glucose levels remain at a normal and controlled rate. If not properly managed, she decreases her fertility and puts her baby at a higher risk for birth defects. Gestational diabetes is a glucose intolerant onset in the first recognition during pregnancy. Associated with the increase in maternal obesity developing during pregnancy, gestational diabetes will usually go away after childbirth, however. Along with that, though, about half the women who do get gestational diabetes will later get type 2 diabetes within 5 years after their pregnancy if they remain overweight. But if you do not remain overweight, it is likely to go away after birth. Hypertension. Chronic hypertension is another risk factor associated with pregnancy and can be a symptom of pre-existing or gestational diabetes. Women with high blood pressure, hypertension, also face a higher risk of general diabetes and developing gestational diabetes during pregnancy. Hypertension during pregnancy can lead to other problems later on in pregnancy as well. And some common symptoms would be like nosebleeds, headaches, chest pain, blood in the urine, vomiting, and dizziness. Preeclampsia. Preeclampsia is a condition characterized not only by gestational hypertension but also by protein in the urine. Preeclampsia can largely be related back to hypertension and have a strong effect on the mother's body. The circular system, liver, kidneys, and brain, and blood flow to the blood vessels that supply oxygen and nutrients to the placenta very strongly will diminish. For this reason, preeclampsia often restricts fetal growth, and in some cases, the placenta separates from the uterus, resulting in stillbirth. It is important to manage preeclampsia as it can develop into eclampsia later on, which is a condition characterized by seizures and comas. This can be fatal to you and the baby. How age will affect pregnancy. The ideal childbearing age is between 20 to 25. Both older and younger women will likely face more complications. Women under 25 are less likely to receive prenatal care and more likely to birth a low birth weight infant. And then pregnancy in older women are less likely to have complications, but will often have issues that reflect chronic conditions such as hypertension and diabetes. This can affect the overall health of the fetus and baby. Incompatible pregnancy and breastfeeding practices. Besides malnutrition, there are many other practices that are incompatible with pregnancy and can negatively affect the baby and mother's health and increase risk of complications. Alcohol, nicotine, and other harmful substances taken while pregnant are guaranteed to cause irreversible damage to the fetus and baby. However, there are also many other less known practices that can negatively affect a mother and baby, such as environmental factors like air pollution, undiagnosed herbal supplements, foodborne illness, caffeine, restrictive dieting, vitamin or mineral overdoses, and oftentimes raw fish can all harm the developing baby during pregnancy. Nutrition during lactation. There are many positives to breastfeeding for both the mother and the newborn infant. Breastfeeding is a naturally available source of nutrients and food for the infant that will help them develop in a very natural and supportive way. For the mother, breastfeeding can conserve iron stores and protect them against breast and ovarian cancer, as well as reduce the risk for type 2 diabetes, hypertension, and heart disease. Physiology of lactation and breastfeeding. Lactation is production and secretion of breast milk for the purpose of nourishing an infant. The mammary glands, as you can see in the picture here, are the female glands responsible for this action. There are two main hormones as well that can help with lactation. Prolactin and oxytocin will help finely coordinate lactation as well as help produce it. Without these actions, it is not possible to lactate.